My name is Jim Easton. I'm the National Director for Transformation for the NHS Commissioning Board. Well, we've reached a conclusion across the service that the leadership skills and capabilities that got us to a great place in terms of changing the NHS over the last 10 years aren't the same as the ones we need going forward, facing this challenge of economically tough times and further drive to meet greater demand and improved quality. It's not as though we're rejecting what made us great, but we needed to build on it. And that to do that really well, we need a focused effort on high quality interventions to take forward our leadership capability, whether that's for our most senior leaders, our clinical leaders, our young and emerging leaders, our leaders from black and minority ethnic backgrounds. And the job of the Academy is a strategic intervention. There are some things that are done well, done best if we do them at scale. The Academy is a strategic intervention to do those things to the highest standard. And through the Academy we need to link with and support a much larger volume of work that's going to be done locally in developing local leaders, taking forward programmes of change that require leadership development. Well, there'll be a range of entry points for people into the work of the Academy. To start with, there'll be a broad set of offers that will be widely publicised and that we hope people walk towards. For the individual components, we'll have different processes. So for the top leaders process, as many people know, we ran through quite a controversial process of working initially through strategic health authorities, as it was, to identify those people doing the key leadership jobs in the country. And in a new environment, bringing in new partners like CCGs will refresh that process and try and identify more directly those people doing big jobs. For other programmes, there'll be entry points that people can find locally. So the Academy will try and flex the way of getting into programmes so that it both identifies people directly with key roles and allows entry points for people who are hungry to take part in the kind of development it offers. One of the lessons we've learned about things that we do nationally at scale is that there's a terrible tendency for them to grow bigger and bigger and bigger and try and do too much. And one of our disciplines is to working with the service, driven by the service, to be really focused on what are the small number of things that you do best if you do them once nationally, and to focus on doing these things and not to have mission creep, not to try and run things in Norfolk and in Northumberland, but to link and support those processes. So as the person who's got overall responsibility for the Academy on the Commissioning Board, whenever we talk about expansion, my focus will be on tightening the remit, being clear about doing the things we do well, and working with others where you need to develop more capacity and supporting them in doing that work. When we look at great organisations around the world, large organisations, they have a focus for investing in their people who lead in difficult environments. And the NHS, not an organisation, but as a system, needs to do the same. We want it to be felt as owned by the system and responsible to the system. And whilst the Commissioning Board is launching it initially, our emphasis is to make this something that increasingly feels owned by, belonging to the whole of the NHS family. The NHS is facing the greatest challenge since its creation. Having taken the NHS from being, 15 years ago, frankly, a service that was many people thought past its best days, and over the last decade or so transforming it to a service that holds its head high by international standards, we now face a period where, frankly, there is threat to that position again, where the economic challenge the country and the world face constrains our resources. And if we do nothing, the natural tendency would be for performance to worsen, waiting times to lengthen, buildings to decay, morale to fall. And we have to not do that. We have to take the opportunity of this problem and take the NHS forward. That requires change at a scale and a pace that we haven't done before, and we know that what change at that scale requires, the fundamental difference between success and failure is the calibre of leadership.